Pathogenesis of hypertension. The main cause of hypertension is atherosclerosis, that is hardening of the and stiffness of the arteries produced due to plaque formation in the walls of the arteries. There is contribution of alcoholism and also the tobacco smoking, sedentary habits. Then there is tension, anxiety, stress conditions. They are the factors contributing, especially the obesity, yani the lack of control over the body weight. So these are the basic factors, and also due to excessive intake of salty materials, food, especially the sodium, salt, and also the saturated fat. These are the main factors which produces the blood pressure, high blood pressure in the human being, due to which there is increase in blood volume, increase in blood cardiac output, cardiac ejection, and there is also increased resistance of the walls of the arteries due to hardening and the stiffness, rigidity produced by the deposition of the plaque formation in the vessel walls, and they produces the nerving of the lumen of the arteries. So these are the main factors which is causative of the high blood pressure in the human body. So these produces the changes in the blood supply of the vital organs, especially the heart, kidney, and brain, and the eyeballs. So complications which are produced by the high blood pressure is there is damage to the endothelium of the arterial walls by the excessive pressure of the blood, because there is excessive work of the ventricles to pump the blood onwards into the rigid vessels. So there is hard work of the heart muscles of the ventricles, because there is resistance. The vessel walls, they produce resistance to the flow of the blood, which is pushed by the contraction of the ventricles due to deposition of the plaque formation, and also due to the increase in the blood volume, and that produces the cardiac output, and the cardiac ejection is also increased. So there is burden over the ventricles muscles, and they may undergo or usually undergo the enlargement of the left ventricles found in the older patient of the high blood pressure. So various complications which are produced, that is the renal failure, there is stroke due to ischemia of the various parts of the brain, then there is blurring of the visions, diplopia, and due to retinal hemorrhage, there is retinal tears, so that may lead finally into the loss of the visions. Heart attack due to formation of clot and the thrombus in the coronary arteries, that produces occlusion, the blockage of the flow in the coronary arteries, and that is responsible for sudden heart attack. And also there is heart failure, because the pressure over the ventricle is increased. They undergo inflammatory process, there is enlargement of the ventricles, and the efficiency and the power of contraction is decreased. So this is called as heart failure. Then there is aneurysm formation in the various large arteries, especially starting from aneurysm of the aorta. And these aneurysms, they are the weak sacs which may rupture due to pressure of the blood flow. And there is bleeding, and that causes the bleeding crisis, the shock condition in the body. So these are the various complications of the high blood pressure.